Good morning. It's May 7th, and this is to my liberal friends. Well, Republicans are looking for savings in the budget, and it has to become obvious that the major source of savings is in the social welfare system. Since Medicare and Social Security are off the table, per Trump, then Medicaid and SNAP, commonly known as food stamps, become a target for saving money. Like any government program, both of these have grown exponentially over the years. They're just out of control. In the latest data available from October 2024, there were just under 80 million on Medicaid and Children's Health Insurance Program, CHIP. Breaking down the numbers, you find that 72 million were enrolled in Medicaid and a little over 7 million were enrolled in the Child Health Care Program. This represents 47% of the total Medicaid and CHIP program enrollment, with 37 million of them being children. That means that 19% of the nation's population is now on Medicaid. This is a joint federal and state program to provide health care for the poor, and it just keeps growing year over year. Medicaid has a 5-year look-back requirement to ensure you don't have assets that could cover regular insurance. But there's a cottage industry out there on how to avoid that look-back, and you simply have to put your assets into a trust or transfer them to another person, and you'll continue to receive these benefits. And this is very common with elderly people who are both on Medicare and Medicaid, and their families engage in tactics to ensure the funds are there for them later on. Under Obamacare, it expanded the ability of people to qualify for Medicaid, and between 17 and 20 million people were able to sign up for the program. The estimated cost of these additions were about $1 trillion over a 10-year budget cycle. Under the new rules put in place by the National Center for Policy Analysis, estimates that every tax dollar spent on Medicaid expansion, at least half went to new enrollees who dropped their private health plan to join the program, rather than to previously uninsured people. For the related state children's health insurance program, the crowd-out effect averages about 60%. In other words, people drop the insurance that they're paying for simply to get on the free government program. What that tells you is that due to the expanded ability to qualify for Medicaid, millions of people drop these private insurance programs simply to get on the free government program. The sheer scope of the Medicaid program today would have shocked its designers. Politicians, analysts, and the media tend to focus their attention on the controversial management, rapid growth, and shaky finances of Medicare, and yet Medicaid enrolls more people than Medicare, spends almost as much on hospital and doctor payments, and presents the government health providers with at least as many fiscal and managerial headaches. So when you hear Democrats say you better not touch Medicaid, they're simply endorsing a program that brings them one step closer to a national single-payer healthcare system. There are significant savings to be found in this program, and it's fraught with waste and abuse. And that brings us to food stamps. Right now, over 41 million people are on the program. The program long ago ceased to be temporary help to those who fall in hard times. Enrollment doesn't shrink any longer in a strong economy as it should, and the rolls include millions of adults who can work. The program is contributing to one of America's most pressing social ailments: prime-age men not looking for work and its attendant disciplines and contributions to society. The program on paper requires that able-bodied adults without dependents work part-time or lose benefits after 3 months. Yet the Economic Policy Innovation Center, a think tank, estimates that a mere 16% of these adults work 20 hours a week or more. Government data suggests that only 28% of such adults have any earned income. That's in part because states exploit waivers from the federal government to dilute the work requirement. States rely on old unemployment data and gerrymander regions to paint locales as scenes from the Great Depression. By one estimate, nearly 40% of these able-bodied adults without dependents live in areas where the work requirement has been waived. Congress can crack down on the waiver offenses and make work a centerpiece of the program in the tradition of the GOP's 1990s welfare reform. The 20-hour work requirement ought also to apply to those who have children old enough to attend school. But the food stamp dysfunction runs deeper. States manage the program, but the feds pick up 100% of the benefits tab, which means states have an incentive to draw down more federal dollars. No wonder the program's improper payment figure is north of 10%, and that's according to the Department of Agriculture and their own data. One of the major problems with SNAP program is how it's currently configured. It acts as a deterrent for recipients to work more hours because they start to lose benefits. So they just work the minimum if they do work at all. But politicians are loath to reduce benefits because I've said repeatedly, everyone's for reducing spending except when it cuts their benefits. Multiple policy analysts have proposals giving states a stake in the program, and President Trump's 2018 budget included a version of the idea. Now, Congress can ask states to pick up 10% of the benefits to have the first year, then 15%, and in fact, eventually 25%. EPIC, the think tank, estimates the feds could save $250 billion a year over 10 years by phasing in state share to 50%. But that won't sit well with governors in both parties because they would have to make up the difference out of their budgets. But if you go back to the 1990s and look at what happened with welfare reform under Clinton and the Republican Congress, the states became encouraged to find ways to get people back into the workforce. Democrats will attack Republicans as heartless if the GOP even touches the food program. So there's nothing to gain from a preemptive surrender. America's food safety net should be fiscally sane and offer incentives so recipients won't need forever. If Republicans can't defend these basic principles of self-government, they got bigger problems than passing a tax and spending bill. We're in real trouble. This has been To My Liberal Friends. Thanks for listening.